Hi, I'm Dr. Dadvand. I'm a board-certified plastic surgeon here in Beverly Hills, and I specialize in gynecomastia surgery. And in this video, I'm going to answer your most frequently asked questions about gynecomastia. So I get this question a lot, especially online. And so the answer is, it depends. Now, the most common time to get gynecomastia is during puberty. And so about 40 to 50% of boys going through puberty get gynecomastia. So in a large proportion of them, over 80, 85%, it does go away by itself in about a year or two. But there's still that small percentage of kids, about 15%, it doesn't go away. And so I'll say the answer is, yeah, it can go away, but if it's going to go away, it's going to go away in a relatively short period after you've developed it. So one of the biggest myths about gynecomastia is that these guys are just not doing the right exercises, or not eating the right foods, or not maintaining their weight. Gynecomastia means having too much breast tissue that's making a feminine chest. So diet and exercise isn't going to address the breast tissue. It will make the fat levels go down in the chest, but the breast tissue does not change. And so that's the big myth, that you can diet and exercise your way out of gynecomastia. You cannot. If you have true gyno, having too much breast tissue, you need to have that removed or take certain medication, if you catch it early enough, to shrink it down. So most of the cases that I see, the gynecomastia is on both sides. However, I do a lot of these surgeries, and so I'm definitely seeing patients who come in with just one side. And whether the cause was puberty or from steroid use, for some reason, some guys just get it on one side. Now, there's not really a 100% known reason for this. One postulation is that they might just have more estrogen receptors on that side than the other side, but it definitely is not only the case that it happens on both sides. Guys can sometimes just have it on one side and not have any abnormal amount of breast tissue on the other side, or they can have one side that's much larger, or noticeably larger than the other side, but both sides having it. So I get this question asked a lot, even in consultation. Hey doc, what weight do I have to be for surgery? Now, the thing is, you can't be obese or morbidly obese. I just don't think it's safe to operate on people who are way above their ideal baseline weight for surgery, because it's just not going to get you as good of a result, not to mention that you have slightly higher risks from the postoperative recovery standpoint. So do you have to be in your best shape of your life? No. I always tell guys, hey, get into the shape that you feel good at, that you feel good about your body, but that you can maintain as well. There's no point in getting to the lightest weight you can, doing the surgery, and then gaining another 20 pounds afterwards. That's going to take a toll on your chest, on the skin, and it's just not going to give you the results that you want long-term to be able to maintain. So you don't have to be at your ideal BMI, but you want to be at a weight that you can easily maintain with just regular habits of diet and exercise. So there's no such thing as an invisible surgical scar. However, gynecomastia incisions tend to heal really, really well. And I tell patients that it's for three reasons. Number one, I close them really well. I use 3 layers of sutures to make sure that they're closed properly without tension. Number two, I place the incision right at the border of the lower areola, where the color of the areola and the color of the skin meet. That color differentiation camouflages that incision. And then number three, because I put it at the bottom of the areola, that part of the areola is already curving down off the pec, so the light does not hit it directly. Had I put that incision on that top part of the areola, you may notice it more. So those 3 reasons are why these incisions tend to heal really well. Now, the caveat to this is if you have a grade 4 gynecomastia or a lot of extra skin and we need to do bigger scars, those I can also get to heal nicely as well, but they will be more noticeable because they're off of the chest and off the areola. But in general, for grades 1 through some 3s, the incisions tend to heal fantastic. So this is an interesting question. So you have to be 18 or over to be able to give your own consent to have surgery, but I do a lot of these surgeries in people who are under 18. Gynecomastia affects kids during puberty, and so I have a very specific criteria on the teenagers that I operate on, because the last thing I want to do is to do an unnecessary surgery on someone who might have their gynecomastia go away in a period of time. So for me to operate on teenagers under 18, obviously they have to have the consent of their parents, but number one, they have to have a gyno that's been there for at least 3 years without any signs of it getting better. Number two, no other medical issues that could have been responsible for the gynecomastia. And number three, a normal hormone panel. And so if they've met all three of those criteria, and I don't think that their gyno is going to get better by waiting till they're 18, and as long as their parents consent, then I will do surgery under 18-year-olds, and you do not have to be 18 or older to have this surgery. So these were the answers to your top asked questions online about gynecomastia, and I hope this video was informative. And really, that's the whole point of my YouTube channel, is to provide valuable, informative content for you guys. And if you like this content, be sure to hit the like button, the subscribe button, and the notification so you can keep getting these when they come out. And be sure to follow me on the other platforms such as TikTok and Instagram. Until next time, guys.